Hi, I'm Christie Morrison, again, one of your local APPs here with the GHAPP MASLD MASH Community Network. Here to address some common questions that we get from local community GI providers about MASH and MASLD. So one of the very common questions that I see a lot of is, when do you refer your patients with MASLD and MASH to a transplant center? And so I'm going to really kind of answer that in a couple of different ways. It actually is pretty variable. So I kind of will make sure that I'm using my non-invasive testing, such as my ELF fibrosis scores or FibroScan, to really help me stage their MASH. If the patient has F3 MASH, then that's the person that I'm starting to send to a hepatologist to look at getting them on regular monitoring and just on the radar for the transplant hepatologist to be aware of them and get them in-house so that if they do get to that progression to cirrhosis, that they're already there. We think, although it's not in the guidelines at this point, we do believe that F3 fibrosis has the potential to really jump quickly into cirrhosis. And there is that increased risk of hepatocellular carcinoma as well when you have cirrhosis of the liver. So for those patients that have that F3 fibrosis, I'm going to be a little bit more aggressive with them. Also, depending on where you live, it might be a challenge to get the patient in to see someone. I'm in a large city here and we have 2 transplant evaluation centers here, but commonly it's 3 to 4 months before the patients can be evaluated. So if you're waiting until the patient already has cirrhosis, we're kind of behind in the game there already. So we want to get them started as soon as we know that they have advanced fibrosis that could lead to cirrhosis quickly. So they're already on the radar. Hopefully they won't advance to cirrhosis in 3 months, but that way they are getting into the place where they need to. Also, these transplant centers have a really good interdisciplinary care system. So they're usually including other practitioners besides the transplant hepatologist, to include like your psychologists and your nutritionists and other people in general that can help the patients make positive change in their lifestyle to prevent progression, and also just teach them and help them with this diagnosis because it is life-changing. So using those resources available to you earlier rather than later can help prevent those commonly, longer waits for the patient, and also allow it to be easier for the patient to get in, especially if you live farther away from a transplant center, so that if they need to travel, they can make arrangements to get in sooner rather than later. The other common question that you see a lot is, how do I evaluate MASH when I don't have access to a FibroScan? FibroScans are expensive and not every office has access to them. Even in a large community center, community like San Antonio where I live, it's not something that I have access to every day for my patients. So fortunately, I do have research centers available that I can send my patients to get FibroScans pretty regularly. But we're also really lucky to have some additional non-invasive testing besides just FibroScan that can really help you determine the need for FibroScan as well. And that's through things like our just FIB-4 score, starting there, which the patients come to us with usually from PCP. But if not, it's very easy to calculate by using an AST and ALT and platelets through using an app called MDCalc, or ordering a FIB-4 score to your local lab, which can automatically reflex to an ELF score. The enhanced liver fibrosis score is a really great non-invasive testing that will give us a really good sense if the patient has low, moderate, or severe risk of developing or already having fibrosis of the liver, similar to what our FibroScan will do. So if you don't have access to FibroScan right in your community, or it's not easy for your patients to get to, just depending on the hours, etc., then use that enhanced liver fibrosis score in addition to your FIB-4 score as well as a blood test can usually be easier and have better access for your patients. So those are my top 2 questions from community GI providers. I thank you guys for joining me tonight, and please feel free to navigate around my website and look at other great websites and podcasts around treating our patients with MASLD and MASH.